Good evening. Welcome to our show, Aging Matters. I am Kathy Monroe, and I'm Executive Director of Berks County Area Agency on Aging. Tonight we're going to talk about the elderly and vision. I have with me tonight the privilege of having Don Gemmiti here, and also Dr. Dawn Hornberger. And Don Gemmiti is here representing Berks County Association for the Blind. Good evening.
Good evening.
And thank you for being my guest this evening. Don Gemmiti, that is. This is going to be a little difficult with a Don and a Dawn, so I don't know if I'll say Don and Doctor. Maybe that'll help it a little bit. Don, talk a little bit about your experience and working with the Berks County Association for the Blind and working with people who are vision impaired.
Well, it's kind of interesting. My experience is personal in the sense that my father was blind the last 10 years of his life. So as far as working with this agency, I've only been there 17 months. I was brought in to kind of right the ship and to make some changes as far as our program, services, and delivery, and to stabilize the operation. So we are seeing more and more a need for, and we're opening about between 8 and 10 cases per month currently since January. So we're growing our base. We serve, our direct services are to about 600 clients. Wow,
that's a large number of individuals. Dr. Hornberger, talk a little bit about who you are, what some of your credentials are, and what part you play with the elderly and vision loss.
I'm a local optometrist and low vision specialist. I have two of my own practices in two ends of the county, one in Warnersville and one in Birdsboro. And I've been practicing for over 25 years. And I also am the low vision consultant with Eye Consultants of Pennsylvania in Wyomissing. I do basically routine eye exams, as well as I work with the visually impaired on a regular basis. And I also am on the board of the Berks County Association for the Blind, and I am the head of the Site Conservation Committee, which oversees making sure we're providing social services and meeting the needs of our clients. I work more as the vision consultant on that board and helping to facilitate that area of providing help for the people who are visually impaired.
Okay. I want to talk a little bit about some of the most common, I guess you could say, eye disorders or low vision problems that the elderly may encounter. I'd like to talk about like floaters and dry eyes and nearsightedness, and glaucoma, cataracts, macular degeneration, and I could go on and on.
Do you have one in particular you want to focus on?
Okay, let's talk about, well, I want to talk about one because, you know, I'm close to this one. You know, I have, my mom is dealing with the early stages of macular degeneration. Let's talk about that one first.
Macular degeneration is extremely common, unfortunately, in the elderly population. It's very rare in people who are younger, although there are some forms that are hereditary in nature. But it is very common as we get older for people to have poor circulation and waste products building up in the back of their eye, and it results in a loss of the central vision. It's somewhat misunderstood by family members sometimes because the person will still be able to get around. They have perfectly good side vision. They don't ever completely lose vision, but they lose the ability to see details, seeing people's faces, to be able to read, see TV. You know, those sorts of activities are difficult. However, there is a lot of help for people who have visual impairment due to that problem or other problems. That's where the low vision services come in, and not only can we help with providing direct services to help them with optical tools that will help them see better, but often there are other services such as what the Blind Association provides, where we're able to provide training, we're able to provide counseling services, we're able to provide support group services. There are a number of other services available to the patient in addition to actual direct eye care related services, and that's one of the roles I have.
Okay, you said something there that caught my interest. You said optical tools or devices that help them. Yes. Talk a little bit about that.
Well, sometimes it's as simple as just using a slightly different type of glasses than what somebody was using before. They might need a special pair of glasses that's just for reading. They may need a higher bifocal power than what they were traditionally using. Sometimes it is as simple as a pair of glasses, but as visual impairment becomes more severe, then we have to go on to telescopic lenses or perhaps magnifiers of some sort, or even sometimes special electronic equipment that will actually allow them to be able to function better using magnification through that.
Okay. Now, another one would be glaucoma. Let's talk a little bit about glaucoma. And is that specifically age-related?
Glaucoma can actually hit children as well. You can actually have glaucoma as a congenital thing that you're born with. It's fairly uncommon as a problem with young people, very uncommon in children if it's not diagnosed at birth, although it can happen. The majority of people with glaucoma are over the age of 40. That would be much more typical. Not that it can't happen earlier than that, but it's much more common over the age of 40. And the older you get, the more likely you are to develop it. And glaucoma basically affects the optic nerve. In most cases, the eye pressure goes up in the eye and it damages the optic nerve, and it causes typically loss of peripheral vision first and then eventually central vision. It's sort of the opposite to the macular degeneration. You lose the side vision before you lose the central vision. So your acuity, your clarity is probably not too bad initially, but you may start having problems with bumping into things or getting around and that sort of thing. Glaucoma is often a very treatable illness, but it has no symptoms in the early stages. Nobody notices that there's any problem, and the people who say, oh, I don't need an eye exam, I can see fine, unfortunately, till they can't see fine, it's too late.
And I guess that's what my next question was going to be. How do you know? You said eye pressure being up. How does the person know if eye pressure is up, or maybe they, think that they have a headache or something like that without actually seeing going to a vision specialist?
The vast majority of people with glaucoma don't have a headache. They don't have any symptoms. That's the problem. And especially in the African American population, it is extremely common and it's usually more severe. So there are a lot of people who, again, they think, I can see fine and nothing hurts me, I'm okay. And glaucoma is the big sort of masquerader for that, you personally would not know you have a problem until you lost the vision.
Is it inherited?
It can be.
Okay.
Yes.
All right.
Yeah.
And then there's cataracts. Lots of people have had cataract surgery, and I even know some that may have had a cataract removed from one eye and then turn around and have to have it removed from another one.
Cataract surgery is actually very, very common, and while it involves using a very skilled surgeon, the actual procedure itself is not difficult and is very successful, very low risk. Cataracts happen to pretty much everybody if you live long enough. So it's something.
Right?
It's basically just a cloudy lens in the eye, and as with everything else, things wear out, and essentially the lens just gets more and more cloudy as we age. It's just part of the normal aging process. And if it gets cloudy enough that it affects the vision, we can just remove that lens and put a new one in. And the nice thing is it's usually very routine and very really not a recovery time. And it's something that pretty much anybody will need to have done if they live long enough. So cataracts really aren't a big concern anymore, as long as you live somewhere where you have access to surgical care.
Okay. Yeah. I guess I want to now go to things that are maybe not as, I don't know if it's not as serious or not. You would be the better one to evaluate that. Floaters and dry eye. Are those things that are leading to something, or is that something that is a flag, a red flag, or what? If you have floaters in your eyes, and I think people can have floaters at almost any age. Is that correct?
That is correct. Some people have had floaters since birth. There are some pieces of the there's things that are in the jelly in the back of the eye called the vitreous, and essentially a floater is just something that's floating in that vitreous that comes past the line of sight and causes a shadow.
And is it true that we can get used to those floaters?
You do. You tend to ignore them, or if you're looking at something that's a complicated environment, you usually they fall between the cracks and you don't notice them as much. If you look at a white wall or a blue sky, something like that, they're much more obvious. Everybody has some floaters. The concern is if all of a sudden you start noticing a large floater or a whole bunch of floaters, and especially if it's accompanied by flashing lights that you don't know are not really there, or if you have a loss of peripheral vision or any kind of blurred vision that goes with it, definitely it needs to be checked, because it can be an early warning sign for a retinal detachment or a tear in the retina. The everyday little buggy things that float around in the vision are usually nothing that's a concern, but it's always better to get it checked, because it can be a warning sign for a retina problem.
I see. And with all of these vision issues that we have, fortunately we do have Berks County Association for the Blind. So Don, I want you to talk about the services that you provide at Berks County.
Okay, I believe we have a visual that we can put up,
Okay.
and
Can we have the visual now?
I think maybe, oh, here it comes. We do vision screenings for adults as well as children, and those are screenings, those are eye exams, and they're available at no cost. We also operate sight loss support group, I'm trying to read out here, which is for our clients that are visually impaired or blind, that come on a regular basis, on a monthly basis, to a meeting where they can talk about their issues and what's happening, and we update them on certain things that are happening in certain programs. For example, technology today is amazing. That through the iPhone, there are money counters,
Right.
color detectors, all those type things. Everybody talks about Braille. Well, Brailing is really not passe, but
Getting
it's
outdated, is it?
yeah,
Okay.
a lot. Yeah, it is. But there are certain people that still continue to do Brailing. We have a counselor on our staff that is blind and actually lost his sight in the 8th grade, that can Braille as well as use his iPhone app. Caregivers support group. When we think about people losing their sight, and I mentioned that my dad lost his sight 10 years before he passed away, caregivers are dealing and struggling with how do they adapt. Now, in some cases, how do they adapt to a situation where a stroke, their loved one had a stroke and woke up and they were blind.
Wow.
So they had to deal with two situations. So this is an everyday type issue that caregivers are looking for an opportunity just to talk, not to, and see what is common as far as what other caregivers are going through. Lunch bunch program, and that's purely socialization. It's going out in the restaurant and ordering a meal and just having a good time. We were talking earlier, Kat, about some people that have sight see individuals that are sightless and they don't know how to deal with it.
Right.
And we're trying to get them to adapt into as much as possible and be independent in ordering food, and they get some help, but it's good for them to get out. So we go to local restaurants throughout Berks County. Information and referral. We do refer to Bureau of Blind and Visual Services, your agency.
Right. Okay.
And and other agencies, Berks Encore and whatnot. So I mentioned the private counseling aspect, and I think the key is that we have a young man that's 24 years old that lost his sight, as I said just a couple of minutes ago, and is doing an outstanding job in working with individuals transitioning from sight to sightless, which isn't it's difficult to adapt to that.
What we're going to do now, Don, we're going to take a brief break, and then we're going to come back and we're going to talk about your talking books. Is that right?
Sure.
Okay, thank you.
Yep.
bctv.org. Be informed, be involved, be a member. For membership information, go to www.bctv.org/support/membership. For other stories and information, go to bctv.org.
Welcome back. Now we're going to talk a little bit more about vision, and we're going to start out by talking about talking books.
Well, this is a service, Kathy, from the Free Library of Pittsburgh.
Oh,
It used to be a Free Library of Philadelphia. Now it's coming out of Pittsburgh.
Okay. All right.
And it's all digital now, and they get a recorder. And it's a free service. It comes through the mail. We provide the recorder. We can get them set up. And then they get the tapes on a regular basis based on what they want to listen to.
Okay. All right.
One of the things, just as a takeoff, we've had some discussions with the Reading U company of the possibility of having sections of the newspaper, local news, being recorded and then sending it to our clients.
Great idea.
So to keep them informed and keep them posted.
Yes.
Assisted devices, as Dr. Hornberger mentioned, there are all kinds of tools. We have what we call CCTVs. These are just magnifiers. There are different types, some that have different colors, some that can just pure black and white. And this gives people that have some sight still some independence. They can do their own checks. They can read the newspaper. It's a magnifier. And those they can purchase from us. These are I like to think, experienced, meaning they're used,
Right.
okay? CCTVs. And usually they run for about $3,000, and we'll accept a donation, a couple of $100 or whatever. And if somebody can't afford it, we'll loan it to them.
Oh, okay. And then, Dawn, I know that you also, for individuals who operate a computer, there's also visual aids for them as well, maybe a larger screen or
Yes.
magnifier and things like that.
In fact, our council uses a program called JAWS, which it's
Spell that for me.
It's like JAWS, J-A-W-S.
Okay.
Yep.
All right.
And I don't know that much about it because I'm not very tech-oriented, but when he does his notes, it plays it back to him.
Okay.
Okay?
Okay.
So a lot of different things technology-wise in computers, and you said large screens and things of that nature, but also programs especially for individuals that have visual issues. Education program, well, we try to educate as much as, do educational programs as much, and Dr. Hornberger can talk to this one about vision summits, which I think is pretty interesting. We only do them twice a year, but we're going to try a new method.
We are hoping to initiate a new program in October where we're going to be providing a vision summit during the day. We had attempted to do it in the past in the evenings, and we're finding that might be difficult for people to find transportation, as the elderly population is more the group that we're usually getting for these things. So we're going to try to do a lunchtime program at the Blind Association, and I will be actually the featured speaker in October, and I will be talking about low vision and the various assistive devices that are available. So you can look forward to that. And usually about twice a year we're going to make a goal of having educational seminars that are open to the public about various topics. We have already had one on macular degeneration and one on glaucoma. We had Dr. Monroe, who's a retina specialist locally, and Dr. Tellez, who's a glaucoma specialist locally, do those programs in the past. So we're involving people in the community to do that.
The other thing is that we're trying to reach out to the various independent living facilities and doing support groups and helping them with their particular residents that need microwaves marked or clocks or whatever be the case. We also have a variety of talking watches and big button telephones and stuff. So we are reaching out, and we want to do more with the senior population.
Okay. And thanks for the handout. We appreciate that. It can come down now. One of the things that I think that is a little different, I have a friend that's legally blind, and the thing that they struggle with the most, they said, is that here in the United States, we're different than most countries, because most countries, when it comes to paper money, it's in different sizes. But our money is all, our paper bills are the same size. What is something that could help someone who has low vision handle is there any solution for that, handling paper money, bills?
Well, there is an app with the iPhones. They can actually read it and tell you that it's a different currency.
Oh, so you just flash it over your iPhone
Apparently
screen?
so. Yep.
Okay.
And we're finding more and more individuals, our clients, if they don't do that, at least with the coins, they can tell the difference between a quarter and a dime, a penny. When it comes to the bills, though, that becomes the issue, and that's where the technology comes into. play.
Before the onset of the technology, that you just had to kind of keep them separated. You know,
Right,
you'd keep you'd have a wallet that had compartments, and you'd keep everything separate and just try not to get it mixed up.
I guess
Or-
it would be the old-fashioned way.
Yeah,
instead of
yeah.
the
Just be very
newfangled.
organized.
But a lot of people probably still do that, especially when we think about our elderly who may not be that adept at using, you know, more modern equipment such
Sure.
as our iPhones.
Yeah.
So they probably do still use that,
It-
have that same system in place.
I believe in my dad's case, my mother gave him all dollar bills.
Okay.
Okay,
that's
so
how you
that's how
resolve
he
that.
adapted. So he counted out. You know, he knew that they were all ones.
Okay.
So
All right.
I think there are ways of doing things. Our clients themselves, and we have a gadget guru that is on our newsletter that's testing out various technology pieces. But there are other people that are adapting to their own ways of getting around and using their own methods of identifying money and things of that nature.
Now, do either of you two deal with or are knowledgeable of other aids, such as, you know, we have individuals who actually have service animals, service dogs, and that type of thing that assist them?
Yep.
And what about the training? How are these beautiful animals trained?
Well, I can hit some of that.
Okay, all right.
Mark, who is our counselor, has a CNI dog. Okay, and he went to training with the dog for, I believe he was gone like 6 weeks. So they match him up, and then they actually go out and for a period of time, like I said, 6 weeks. There is a group in the county that does training of dogs, and that try to identify the ones that are going to be best suited for that program. The Lions Club, which is a big supporter of ours, both in volunteers and financial support, they have a program called Leader Dogs, and it's out in Minnesota where they take you out and you're gone for 6 weeks, but you need to qualify. You need to be interviewed and be able to adapt to
Okay.
a CNI dog. But
I see.
there are a variety of programs. There's one in New Jersey which is different than the Leader program. It's the CNI dog, and I believe in Princeton. I could be wrong in the community, but there are all kinds of service animals. But they have to have special abilities,
Okay.
and they're really.
Dr. Hornberger, I would like for you to talk a little bit about eye examinations for older adults.
Well, one of the things is that it is so important to have eyes examined, even if, again, as we talked about earlier, even if you think there's nothing wrong, most things are most easily treated if they're caught in the early stages, and a lot of things don't have a lot of symptoms until it's too late. So very important. People over the age of 65 really should have an eye exam at least once a year, and depending on if they have other health issues, it may be more frequently than that it's recommended. During the eye exam, they will have their vision tested. A typical eye exam would involve checking for glasses or contact lenses and various optical tools, and then measuring the eye pressure, making sure that the eye muscles and the pupils are normal, and also making sure that the eye pressure is normal and that the internal eye health is normal and the external eye health is normal.
So is that the glaucoma exam, that all of that air pressure stuff that you're talking about?
Yes, there are several methods that you can check eye pressure. One is a puff of air. It's more of a screening tool. It's not the most accurate way to measure it. There are other tools that actually come very close or touch the front of the eye. Often the blue light test is what people think about. That's sort of the standard in the industry.
Right.
And there'll be a little blue light that comes very close to the eye and actually measures the internal eye pressure. And often dilating the pupils, it's very difficult to get a really thorough look at the inside of the eye without doing a dilated exam. And so basically what dilating means is an eye drop that enlarges the pupil of the eye and keeps it large for a period of time, so that when we shine lights in the internal part of the eye to be able to examine it, the pupil's not closing down, so that we're not trying to look through a tiny little hole. So you get a much more thorough look that way.
I have a question for you. I know you made the comment that eventually, if we live long enough, we may have have problems with cataracts. But what is it that we can do when we're younger to take care of our eyes for them to be as healthy as they possibly can?
The biggest thing is to protect yourself against UV light.
Okay.
UV light exposure is one of the biggest causes of aging changes in the eye.
Okay.
So if you're outdoors, protecting yourself with good quality sunglasses.
Okay.
Color is not important, UV protection is important. So making sure the lenses are labeled with a UV protective coating. And also eating well, exercising. The better your blood is flowing and the more healthy you are in general, the better your eyes are going to be.
Okay. And I want to ask you one last thing, and I'm going to come back to Dawn. And Dawn, before we close out, I want you to tell everyone where you're located and
Sure.
your phone number. But first, Dr. Hornberg, I would like for you to tell me vitamins, real quick. This eye vitamins that people are taking now.
Well, there's a lot of controversy about that. There have been some very, very good studies about certain formulas of vitamins. You might have heard the ARIDS formula is specifically recommended for people who have a certain type of macular degeneration.
Okay.
A good multivitamin is probably a good idea for macular degeneration. Lutein is the big thing. Some people will advocate fish oil, although that's more recently been not as well documented that that's helpful. But yeah, I mean, I think it certainly in the older population makes sense to be doing some type of vitamin.
Okay. Dawn, real quick, where are you located and your phone number?
Okay, we're located on 2020 Hamden Boulevard, and we didn't pick that number. 2020 Hamden Boulevard in Reading, and our phone number is 610-375-8407. And we have a website, www.burksblind.org, or follow us on Facebook, Twitter, or whatever. They got so many social media
Dr.
outlets.
Hornberg, how would someone contact you?
My actual name is Dr. Dawn
Hornberger.
Hornberger, and I have also two addresses: 247 East Penn Avenue in Warnersville, and 224 North Mill Street in Birdsboro. Phone number in Birdsboro would be 610-582-6000, and in Warnersville 610-678-7202.
And I'm Kathy Monroe saying good night, and you can contact us at 610-478-6500. Thank you very much.